Namaskar. I'm Dr. Devaki Madhav. For COVID affected patients, I'm going to demonstrate, try to teach only two pranayama techniques and then one meditation to raise our oxygen level and then come out from stress, maintain physical and mental balance. Who are all affected from the coronavirus need not worry. You can practice this simple breathing technique. You can yourself can raise your oxygen level, bring the immunity level high, get mental and then physical balance. One who can sit 10 to 15 minutes or 10 to 30 minutes. They may be house quarantine or hospitalized, but they are not under with the help of oxygen. For those, this exercises. Here you need to do two things. One is try to sit as possible as much. Another thing is hands, however you want, you can keep. If you can sit down, you can sit on the floor and do it. Have some carpet. Otherwise, you can sit on the cart, chair, anywhere you can sit. You need not sit on the floor only. If you can sit for 5 minutes or 2 minutes, no problem. How much you can possible, you just practice this breathing techniques. Repetition also, it depends upon your health issues. If your repetition rises, your oxygen level also will rise. Practice with faith and focus on your breath. First thing, you need to take the breath from the throat region. From here only, you need to control your breath. You have to inhale through the with the help of throat, glottis is there now. Of course, air will passes through the nostril only. The nose is only the passage. You should not give force like this. No, that's an unscientific method. You should not do that. You have to practice from here. This is first thing. Another one is while you are inhaling, how much force, how much time you are going to apply. While you are exhaling, also same timings and then same force you need to give. That means 1:1 ratio. Okay? Let me see. I will practice. You please observe in this throat region and also face region. You need to be your face muscles now should not strain. It should not be tensed. Be comfortable and practice. This is first breathing technique. If you can remember, this is a Bastrika Pranayama. It's a type of. If you want full information, you need to attend my camp. Free camp is there. I'm going to give the information about it also in the group. You have observed sound is not criteria. Speed is not criteria. Criteria is here. Inhalation, exhalation should be in 1:1 ratio. That's all. Sit comfortably. You can have any mudra, anywhere you can have. You can keep your hands anywhere. Comfortably sit. Focus on your breath. This pranayama is very, very good for kapha cells. While you're practicing this, you may feel phlegm will come out here. It is coming like that. You just keep waist besides, remove the phlegm. Okay, this is one type. When if you can sit, who can sit some 10 minutes or 5 minutes, they can practice this. They can practice at least 2 to 3 cycles. One cycles means one inhalation, one exhalation. Practice for 10 times. Practice for 5 times. Take rest. You repeat it. Practice 5 times. Take rest. Repeat. Otherwise, if you can practice 10 times, take rest. Like this, no, 5 minutes. Maximum is 10 minutes. That's all. 5 minutes will do for this. Another one, second one is same type of breathing. You need to apply force in the throat region only, but speed is not so much, very less speed. Force is also on the throat region, very less force. Less speed, less force here. For this pranayama, it is called alternative nostril breathing. That means if you inhale through one nostril, you should not exhale through same nostril only. It has to come out from alternative nostril. For example, if you inhale from left nostril, you need to exhale from the right nostril. Then again, inhale from the right nostril, exhale from the left nostril. This is one cycle. One cycle means from left to right, right to left. That is one cycle. Here, two rules, two niyamas. One is less force, less speed. Another one is alternative inhalation and then exhalation. That's all. That is the difference for first breathing technique and then second breathing technique. So you can think from one nostril, if you want to take only from the left nostril, means you need to close the right nostril. You have to exhale from right nostril means you need to close the left nostril. For this, you just use one thumb, another combination of two fingers. Any combination of two fingers, you are comfortable. Be comfortable yourself. If you are comfortable, the oxygenation will be more. Respiratory function depends upon emotions. Okay? I will show you some 3 types of hand movement. Whichever is convenient, you please practice it. Okay? Hands also mudra. Whichever is convenient, you please keep your hands. Otherwise, see, simple. Otherwise, if you are getting pain, just to keep hands like this or this, you can take the help of pillow. Keep like this. See, don't strain your respiratory system. While you are inhaling and then exhaling for this action, you should not strain it. Be comfort, be calm as much as possible, as more time as possible you practice. If you are having a pain in your right hand, you can use your left hand too. See, you can take rest. Okay, this is two breathing technique. You can use both the hands. Style is not criteria. Principles is the criteria. Niyama is the criteria. Your interest is the criteria. How much you are going to practice, so much you can improve your own oxygen level. You can come out from stress also. Okay. Another one, third one. This I will call it as a Pranava Pranayama or meditation, type of meditation. This is for this. No, you need not sit straight. Be comfortable position. Sit on the floor or chair or cot or bench, anywhere. Sit comfortably. Close your eyes. For this pranayama, you should not give force to your throat region. Those two pranayamas, previous pranayamas, through the throat only you need to do respiration. For this third one, Dhyana Pranava Pranayama, this is normal breathing only. Only through the nostril, nose only, normal breathing. Here, what you have to do, normal breathing means what you have to do only, raise your normal breathing timings. For 1 minute, according to medical science, 16 to 18 times we are going to breathe. That's a involuntary. Here, what you have to do is voluntarily, you need to curtail that 16 times into at least 12 times, at least 14 times, 10 times, as less as possible. Okay, for that, what you need to do is breathe, deep breathing. Normal breathing, na, you need to control. Here you are applying the force only to control your breath. Okay. For this Pranava Pranayama and then previous Pranayama, alternative nostril breathing, for these two pranayamas, you need to apply psychology law. Since I am a psychologist, psychology law says there is a relationship between breathing and then emotions. Breathing means inhalation, exhalation. Emotions means dreams, desires, ambitions, anger, anguish state, bliss state, crying, stress, the anxiety, fear, these emotions and all, these are all emotions. That means for the relationship is for the breathing and then emotion, psychology science says. So let us, according to this law, let us practice these two pranayamas while you are breathing, while you are taking your breath. Just recall all your dreams, desires, ambitions. Yes, very soon I'm going to get rid from this. I will go home. Coronavirus is very soon it will go off. I will go to my sister's house, brother house, friend's house, otherwise anywhere out of country and all. I'm going to visit. What are all wishes are there? That means positive emotions while you are inhaling, you just recall that. While you are exhaling, which emotions you cannot express with others, you cannot disclose our worries, anguish state, these things and all know some everyone in that respect. We cannot express our feelings with everyone. That is stress. If that increases, everything will go off. I told you, no, that respiratory system breathing is working on emotions. It affects, emotion will affect for the breathing. So, according to this law, if you practice while exhaling, while breathing out, you just recall all your negative emotions, negative thoughts, your worry, your anguish, everything. You just recall it. What are all emotions, feelings, thoughts you cannot exchange with anybody. If your exchange means that's okay, no problem. The stress won't come only. But it is not possible. So those emotions and all, no, while you are exhaling, you need to recall. See the beauty of this love if you are going to apply on this pranayamas. Within 1 or 2 hours, you just see your oxygen level, oxymeter is with you. Just test with that and text me. Fantastic law. This is psychology law. You need to apply this. Okay. Here, normal breathing only. While you are inhaling, you just focus on your breath. Your breath, from where it is going, how it is moving, where it reaches. Again, while exhaling, your breath, from where it is coming out. You just observe the movement of your breath. That's all. Third one, just observe your movement of your breath. Focus on your breath. Man, if we close our eyes now, our thoughts, our feelings started coming. We cannot focus on breath. Yes, this is common question. This is true also. What you need to do is our emotions, feelings, thoughts, it's us. We are creators. We can't let them go. We cannot remove easily. So we have to live with it if we want to live. What you have to do is while you are practicing this Pranava Pranayama Dhyana, allow your thoughts and feelings to move on here and there. Let it move on. But you're focusing on breath. That's all. Your focus should be on the breathing. Try to practice this. You can. May not be 1 year, 1 hour. In next hour, you may be 1 minute, 2 minutes, like that. You just raises that. It's a very good. You can take you just recall the example of your kid. When it started learning walking, no, usually it fall down, definitely. If the child knows that nobody is there, nobody is looking after me in when it falls and all, no, just it will get up and started moving. If you started observing our child, means it started crying. It will come and attach to it. We are going to fuse with the child. So we are also thoughts also. We should not fuse with our thoughts. Just we need to observe that sound. We allow them to move, but we should not focus. We should not concentrate. We need to concentrate on our breath. That's all. You sit like that, keep on. Observe. That's all. Whenever you don't get sleep, no, you just do this. This is for who can sit and practice these three pranayamas. Who cannot sit even for 5 minutes or 2 minutes, their oxygen level is below 90. They can also do the breathing techniques and they can make their oxygen level high. I will show you how they can do it. These three pranayamas, little bit alterations, that's all. Just to take out your pillow, straight, let the oxygen pipe in your nose only. You keep your hands wherever you want, comfortable, be comfortable. Take the breath inside using your throat. In first exercise, I demonstrated, no, like that only. You can feel your abdomen region, diaphragm, chest moving. If you can practice of one cycle, one inhalation, exhalation, if you want to take rest, take rest. If you cannot practice only, don't try it. That's all. You just try this. Okay. Second one is same position only. Here also you are giving throat only, very mild force, like Anuloma Viloma. But Anuloma Viloma, here we are not operating our hands, just we are lying down in that position only through the nostril with the help of throat. You just inhale and then exhale. The sound, no, only you should feel it. Others should not heard. First exercise, sound will be in snoring sound sometimes. For this, there is no sound, only movement. This also don't force yourself as much as possible. At least one cycle or two cycles, take rest. At least practice for two cycles. Okay, this is third one. Pranava Pranayama Dhyana. Whenever you don't get sleep, no, don't irritate yourself. Okay, don't worry about I'm not getting sleep and all. No, you just sleep like that only. Observe your breath. Don't just focus on your breath. Don't concentrate on your thoughts. simply. No movement, no body movement. So, whenever you don't get sleep, no, you just practice this. Practice for 1 minute or 30 seconds or one cycles or two cycles. How much time possible? You just practice comfortably. Only thing is comfortable in this infected time, no, COVID affected time. You should not strain your breathing. You should not strain your lungs. Okay? Comfortably, happily, with the positive results. Yes, madam has taught this. I will practice this. Definitely, my oxygen level within 1 hour or 2 hours, I can see the changes. Like that, you think. It is not thinking, it is proven one. Hundreds of people they are using these techniques. I am receiving the feedbacks. On that feedbacks reference, just I am telling, if it is a 94, 90, 95, 96, it has rise to 97, 98. If it is 390, 93, it rises to 94, 95. If it is a 87, 86, it rises to 90. I have received many feedbacks. Okay, practice well, comfortably. How many cycles, how many times you can practice, you practice. You take rest. Again, you practice. Take rest. Practice. Take rest. Increase your oxygen level. You can fight with when oxygen level has increased, your immune system will be increased. When your immune system will increase, it's ready to fight with, ready to war with the virus. Okay? The victory is yours. Thank you all. Please utilize this. Please practice for your own health. You can improve your own oxygen. Oxygenation will be more. So thank you all. My prayer for global peace. I'll pray for your health truly. Thank you all.